And
Right.
as soon as you do that, you fall into the trap. You never give the patient the opportunity to have the best care because you never present it. But
this is the Thriving Dentist Show with Gary Takis, where we help you develop your ideal dental practice.
The last question I have, it's from Chicago. I really struggle with deciding when to present only necessary treatment versus presenting a comprehensive treatment plan. How can you help me become more effective here? This is a question I think we get a lot of because many people don't present comprehensive care.
Let me give this doctor an A+ for honesty.
Yeah.
And vulnerability. Now, we're not going to disclose names or anything, but doctor, you have massive company among dentists. And I'll tell you something that happens. This is psychologically what happens. Naren, imagine that if you're a dentist and you keep presenting treatment to people and they keep saying no, 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 no. How does that affect you psychologically?
You want to avoid it. So it's like, you don't want to, like, it's like, imagine, I don't know, like, those experiments given, electric shock.
Yeah.
The animal doesn't want to go there because it knows it's going to get an electric shock. So Same thing, we want to avoid pain.
Yeah. Well, and psychologically, you do that enough, it's going to be, I guess I'm just not going to do that anymore because it's subconscious. You're not making a conscious decision.
Yeah, exactly.
You're subconsciously backing off because your perception is the majority of time this happens, I get a no, and I don't really like getting a no, so I'm going to quit presenting stuff. And As soon as you do that, you fall into the trap. You never give the patient the opportunity to have the best care because you never present it. But really, the key to that is the permission statement. The key to this doctor from Chicago. I really struggle with deciding to present only necessary treatment versus comprehensive treatment plan. When you ask the question, Naren, as you and I are going through these photos, do I have your permission to identify every area of concern that I see? And when they say yes, you just got permission for them to be comprehensive. Doesn't mean they have to accept everything. Doesn't mean everything's complicated. But you've got permission now to be thorough, which is really what this question is. When do I know when to be thorough versus just this thing over here?
Right.
And the permission statement is the answer to that one.
This is a brilliant point, Gary. I think you're hitting on a couple of things that I'm fascinated by, influence principles. And so permission statement is also getting the patient's commitment. So now the patient wants to hear it because they said yes. And the second
remember to tie this back to the some of the tips. When you share with them what might happen, what's likely to happen if they don't do anything, they now have information they didn't have before. The public doesn't know if you're missing a second molar, teeth are going to shift.
Yeah.
Public doesn't know that there's often decay under old broken down amalgam fillings that is going to progress on its own device to end up being a root canal and crown. They don't know that.
Right.
Well, now they do. And you combine all these things together and you're like a guide. You're guiding your patient. And here's the best part about it. Treatment becomes their idea. Well, doc, I had a friend that had a root canal. I really don't want a root canal. That's their idea. I mean, so now how hard is it going to be to schedule the root canal when they told you that, oh, I had a friend at work and he had a root canal and I'd really like to do everything I can to avoid that. Well, okay, here's what we do. We would replace those fillings now. We can do it conservatively and avoid that possibility. Reduce the likelihood of that happening.
One that provides personal, professional, and financial satisfaction.